Hospitalizations in Massachusetts for COVID-19 are now at their lowest levels we've seen in more than a year. Here to talk about that is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Good to see you, Doctor.
Hey, Dr. T, great to see you. So let's take a look at the latest numbers from the state. Right now, 270 patients in hospital beds for COVID-19, and that's down from nearly 1,300 just this past January, and from 3,200 in January of a year ago. That, in terms of numbers, an incredible drop. What can you tell us about the reasons for that?
First, 2 thumbs up. That is great news. I mean, let's face it, we're in such a better place than we were before. You know, I think the reasons are multifactorial, but one is because our immune systems as a population, they're strong. It has memory, so it can remember seeing the virus. For those of us who've gotten infected, which is most of us, and of course the vaccines and that hybrid immunity, being infected before, getting vaccinated, that gives us the strongest immunity. It's also possible that Omicron is weaker than prior variants. What does that mean? Maybe less likely to cause pneumonia or lower respiratory tract infections. So I think a combination of these things. Also, we have better antivirals like Paxlovid than we had before. All of these things are making us less likely to be hospitalized, less likely to die.
Doctor, we've been through a lot of COVID waves, but it's been a while now since we've seen a big one like Alpha, Delta, Omicron. Do you think that means that the worst of these surges is likely over?
Maria, I've always loved the way that you pronounce Omicron.
I can't help it. I went to Greek school for 6 years, okay?
I've tried to actually mimic it, but I can't. All right, I think the bottom line is this. Every peak we've seen has gotten lower and lower. There's been less hospitalizations, less mortality. So I think we're going in the right direction. I expect us to continue to. Remember, it's possible, of course, that things aren't always going in the right direction, meaning the variant could be more severe. But overall, I think the trend is for things to get better and better over time. Again, it's endemic now. That's not to say that in the winter, we're not going to see a spike.
Right.
We likely will, but hopefully it won't be as severe as the last one.
So we've been building this wall here. But as you know, the CDC recently approved the spring booster shot for older adults and people with compromised immune systems. But with infection rates so low, do you think that the booster is still important to get even for those 2 groups?
So remember, Ed, this is important. The FDA and the CDC have only recommended that next booster, meaning a second booster, for those that are 65 and older and for those that are immunocompromised. I think for those groups, since they're the most vulnerable, it makes sense. But here's the good news. The CDC has done some studies that are looking at people that only got the older monovalent vaccines. Most of them got between 2 and 4 doses, hadn't gotten the bivalent vaccine. And most of them still had excellent immunity against severe infection for about a year. Now, remember something. Only 17% of us have even gotten 1 dose of that updated bivalent vaccine. That's important. Even in the highest risk group, the 65 and older, only 45% or so. So what I'm trying to say is we're doing well, even those that haven't gotten that bivalent booster. But with that said, I think the FDA and the CDC are right on. And for now, I recommend that the vulnerable groups go out and get vaccinated again.
All right, Dr. Todd Ellerin, as always, we appreciate it. Stay well, Doctor. Be well.
Great to see you, Dr. T. Take care.